Okay. Hello.
Hi, Kaylee.
Hello. Hi. How are you?
I'm good. Thanks for making the time to meet with me.
Yeah.
Um, so I just want to start off and just ask you some questions. Can you tell me about yourself and tell me why a little bit more about why you want to work at the MGH Psych ER?
Yeah. So I'm a psych nurse practitioner, and before this, I was a nurse for about 8 years in different hospital settings. I started nursing in Florida, and that's where I went to college at Barry University. And then I later went back and I just graduated from Regis College for nurse practitioner. I grew up here in Massachusetts, and then before that, I was living in Florida with my mom. She's still down there.
Mhm.
Most of my bedside experience was med surg or tele. And while I used to think constant alarms and chaos was overwhelming, I actually do find myself missing the fast paced environment now, which is kind of why the ER is more intriguing to me.
Mhm.
I floated to the ER in overflow during my med surg days, but I've never actually fully worked in the ER. So I'm excited for an opportunity because I just feel like that is kind of the environment that fits my current skills and interests.
Okay. And tell me why you chose this career track.
So, psych has always been an interest to me, but I didn't really see a career path until I had my experience as a travel nurse.
Mhm.
I was on a float assignment and I got sent to the psych unit at Salem Hospital actually for the day. And all I did was pass meds because I am not, a psych nurse at the time, but the patients I met that day just kind of changed my perspective.
Mhm.
I realized there was more to nursing than just bedside care, and I wanted to explore that. I later then went to work in an inpatient detox unit, and that's when I was just kind of getting curious about medications, like how do these medications work and when to change them, when to stop. And I just wanted to be a part of that decision making. And so I wanted to move to the provider side of things. And so that's when I applied to the NP school.
Nice, nice. Okay. And what's one of your greatest strengths and also weaknesses?
I feel like for a strength of mine is I'm naturally just curious and I like to keep learning. So
Mhm.
whether it's medical knowledge or just random fun facts, the curiosity kind of helps me stay engaged and adapt to new challenges. I'm just an overall like people person. I can usually connect with patients pretty quickly and just pick up on their energy, and that approach helps me to help them in the right way. But for a weakness, I probably tend to take on too much and I would need to do everything myself, because maybe I feel bad asking somebody to do it, or I don't want to leave work behind for the oncoming shift. I've kind of learned though that I need to delegate more. Healthcare is 24/7, so things will need to get passed on to the next shift. But I still need to do some improvement in that
Mhm.
aspect, I would say.
Okay. And can you tell me a little bit more why you specifically want to work at the MGH Psych ER?
Well, from what I've heard, is MGH has had an amazing reputation for patient care, and the
Mhm.
psych ER sounds like an exciting place to work because every day it's different. You're helping people in crisis, and you're just learning from an experienced team at the same time.
Okay.
I like to work with teams, like in a team environment, and I want to be able to use both my clinical and communication skills to make a difference when patients need you the most.
Okay. All right. That's great to hear. And what attributes do you have that will help you be successful in this position?
I would say that I'm pretty flexible and I can adapt to unpredictable environments.
Hmm.
Travel nursing and working in the flow pool, it taught me how to just walk onto a unit I've never been and figure out things really quickly, find out where things are, and just build rapport with new people. Um,
Hmm.
I'm also pretty organized and good at working under pressure. I like prioritizing under pressure.
Hmm.
That helps me stay on top of my things at work. I'm pretty compassionate, so I'm going to treat every patient with respect without judgment. Even during a difficult situation, I try to bring empathy and a positive attitude because I know how much that matters, especially in psych care.
Good. And where would you see yourself 3 years from now?
In 3 years, I hopefully still see myself in the ER setting. I think inpatient environments are where you can kind of learn the most, especially as a new provider. You're managing crises, making quick decisions, and working with a variety of different patients.
Mhm.
So hopefully, I'd like to continue to grow here and become a strong psych nurse practitioner. So probably I would say in 3 years, still in the ER for sure.
Okay. All right. Sounds good. Um, how do you think a friend, a professor, or supervisor who knows you well would describe you?
Let's see. I'd probably say that I'm calm under pressure, even if I'm full of anxiety inside. It could be the busiest shift, endless running around, unexpected discharges, emissions back to back, just overall chaotic. But
Mm-hmm.
as long as I got some little snacks along the way, no one can really tell when I'm overwhelmed,
Hmm.
because I'm pretty good at keeping myself together on the outside, and then inside I'll keep my anxiety hidden. Um, they would say that I'm also pretty oriented. I'm a clean freak at home, but I try not to bring too much of that into work. But I definitely come in, I have my little routine, I wipe everything down, get my brain together by jotting out a little cheat sheet for the day,
Hmm.
a task list, what I have to do for the day, stuff like that.
Okay.
That's like the way I personally keep detail oriented because I feel like it's very easy to forget things.
Hmm.
Chaos happens and everybody's running around. So
Yeah. Okay. Oh, this sounds really, really good. And what type of work environment are you the most comfortable in?
probably I work best in environment, I would say, as long as I'm with my people. So team-oriented environment. Obviously, at a new job, you typically don't know anybody, but
Mm-hmm.
I kind of sit back, I gather who's good at what, who's the go-to for certain things, stuff like that. And then once I get comfortable and I have my core people, I feel like, especially in nursing, you need to trust and rely on your team members. So
Okay.
whether it's an easy day or a chaotic day, you can get through it if you're working with the right people.
Mm-hmm.
Where my last nursing job, there was a group of us between nurses and MHCs, and we all decided to work double Tuesdays together because we just got along so well.
Mm-hmm.
And it kind of just made the 16 hours, better because you had a buddy to do everything with. If you had to run a group, you had a buddy. If you were getting yelled at by a patient, somebody was going to be there to tap you out. It's
Hmm.
kind of nice being in a trusting environment, I would say, and team oriented.
That's great. You have a great team of people you work with. And then, can you tell me about a time you made a mistake at work and how did you correct it?
So one time I made an error and it was a medication error. And so it was my last job. I was working on the detox unit and we dissolved methadone for diversion reasons. And when I took all the pills to melt down in the hot water, I also grabbed the gabapentin and I already scanned everything before. And so when I went to give him the cup, he was like, one of the pills is missing. And I'm like looking at the screen and I see I scanned it and I
Mhm.
see the empty wrapper. And then so he's yelling at me through the window saying, you stole it or you're trying not to give it to me, da da da, caused a whole scene. And
Mhm.
so what I did is I just believe like getting help owning up to your mistakes right away. So I went to my manager, I told her what happened because being honest and just owning up, especially in healthcare, is very important. But we went and reviewed the camera and confirmed that he actually got it, but I grabbed it and I dissolved it with the rest of his methadone.
Mhm.
um, I felt awful at the time, but I learned from my experience. And now I actually show the patient like the cup of meds before I melt it down. And
Mhm.
then, have him verify like this is your dose, this is the amount of pills, and then I melt it down. It
Mhm.
just also kind of reminded me to slow down, be extra careful, because even in a busy med pass, you don't want to be making those errors.
Okay. Okay, good. And then, all right, all this is sounding really, really good. Um, do you have any questions for me?
Yeah, I have a couple. So
Mhm.
my first one would be, what does a normal shift look like here?
Okay.
And then what support and trainings do new nurse practitioners get?
Okay.
How does a team work together in the psych emergency room here? And then why did the last person in the position leave this job, or is it like a new position opening up?
Okay. All right. These are all really, really good questions. Honestly, you sound like a really great fit. And you know what? We'll get in touch with you soon. Okay?
All right, thank you for your time.
Yeah, absolutely. Have a good day.
You too. Bye.